Welcome to another video. This video is about platelet plug formation, and the objective from this video is to understand the steps involved in the platelet plug formation. Before I dive into the platelet plug formation steps, let's have some knowledge on how blood exists in the blood vessels. So basically, blood exists in the liquid form in the blood vessels, and among the blood there is also platelets. So platelets, they do not adhere to themselves or to the endothelial membrane, and this is due to the fact that they have a negative charge. So there is a negative charge on the endothelial membrane and on the platelet. So basically, when they come too close to each other, they repel each other and they do not attract each other in normal condition. And that is when there is no injury. So moving to the three steps of the platelet plug formation, the first one is the platelet adhesion. So in the platelet adhesion, this basically happens in response to the increasing in shearing force at the surface of the platelet or endothelial cells, and in response to the vessel injury. So once we have a vessel injury, which is indicated by a space over here, blood flows out the blood vessels, and in response to that there is an increase in the shearing force, and this is the factor that actually attract platelets circulating in the blood vessels to this site. So what happened is that the endothelial cells that are in the endothelial membrane start producing a glycoprotein, and this glycoprotein is called Van Willebrand factor. So what happens is that once this glycoprotein is produced, it's bound to a molecule that is in the subendothelial matrix that is called collagen. So once it comes, it gets to this site and it binds to the collagens. And due to the fact that platelet, they have a receptor called glycoprotein 1B1A receptor, which actually bind to the Van Willebrand factor. So what Van Willebrand factor does in this case, it works as a linkage or as a bridge in between the platelet and the collagen. So once this happens, this completes the first step, which is the platelet adhesion. So now moving to the next step, which is the platelet activation. So what happened in this step is that the binding of the collagen molecule to the platelet triggers a conformational change. So in the platelet receptor, this causes the initiation of an intracellular signaling cascade. So what is a signaling cascade? It basically involves the activation of phospholipase C and an influx of calcium, which actually lead to exocytose, the content of granules from the platelet. So basically, once platelets bind to the collagen, they get activated, and due to that activation, they change their shape. So over here we have it into more of a circle shape, and then they change their shape. And this is due to the fact because they increase their surface area. Because the main goal of this whole platelet plug formation is basically to close this space or this injury that has happened to the blood vessels. So by increasing their surface area, they cover more area. So after this activation, in addition to the increasing in their surface area, the activation of platelet caused them also to express a receptor, and this receptor is called fibrinogen receptors or glycoprotein 2B3A receptors. And I will get to this in the third step, which is called the platelet aggregation, why this receptor is actually very important. They also start secreting granules. So basically they secrete two types of granules. The first one is called alpha granules, and the second one is called dense granules. So what alpha granules does is that it releases more of the glycoprotein, the VWF, or the Van Willebrand factor. The reason why it does that, it helps in the assistance with more adherence and activation of platelets that are circulating in the blood vessels. They also release platelet-derived growth factor. So platelet-derived growth factor, what it does is that it facilitates the long-term wound healing. So now moving to the dense granules. Dense granules, what it does is that it releases the adenosine diphosphate, or ADP. So in addition to all this, what's happening from alpha granules and dense granules, we also have thromboxane A2. Thromboxane A2, it gets released from the activated platelet, which actually activated platelet, what they do is that they use an enzyme called cyclooxygenase or COX-1 enzyme to initiate the breakdown of arachidonic acid to thromboxane A2. And this basically concludes the second step, which is the platelet activation. Just before I jump into the third step, which is a platelet aggregation, I just want to mention desmopressin. Desmopressin is basically a clotting promoter. And desmopressin, what it does is that it's used to increase the Van Willebrand factor release from the endothelial cells by 3 to 5 factors from the normal condition. So it increases the release of this factor by 3 to 5 fold. The reason why, because in some people they have inherent a disease called Van Willebrand disease. In this case, they do not produce enough amount of Van Willebrand factor. So in such cases, they end up bleeding for a long time, and the platelet plug formation doesn't happen. And in this case, some symptoms can be seen is that they have a bleeding nose, and it exists in longer duration. So one of the steps they take in treating that, they give them desmopressin, which actually increases the amount of Van Willebrand factor by 3 to 5 fold in comparison to their normal condition. So now moving to the platelet aggregation, which is basically the third step and the final step in the platelet plug formation. So what happened in this step is that the ADP, or adenosine diphosphate, bind to the P2Y12 receptors on platelet. And these are the platelets that are circulating in the blood vessels. In addition, thromboxane A2 bind to TP receptors on circulating platelet as well. And these two binding, what happened is that once they bind to the circulating platelet, they cause additional platelet activation and recruitment, which actually promote platelet aggregation. So this whole process of platelet plug formation is to recruit more platelet to the injury site so that we can close this injury in the blood vessels to prevent blood flow outside the blood vessels. So this basically all what happened in these 3 steps. So I did mention that after the activation of platelet, they change their shape, and we also have another receptors called glycoprotein 2B3A receptors, or fibrinogen receptors. So now this comes into play in these steps. So we have a fibrinogen, which is actually a glycoprotein, and it's actually produced from the liver. And what this fibrinogen does is that it forms bridge or linkage in between the platelet, which actually lead to the participation in the formation of platelet plug, which actually stop the bleeding flow from the injury site. So as we can see over here, there is the fibrinogen receptor, and fibrinogen connect these platelets together. And as we have more platelet come into this side, we form more into the plug platelet formation. And this basically prevent the blood from flowing out the injury site. So this concludes this video. If you have any question, please leave them in the comment below, and thank you for watching.